Hello, thanks for joining us for TD The Whole Story, a new podcast by NOTD, the National Organization for Tardive Dyskinesia. I'm your host, Bill Cody, and today we will be shedding light on a form of TD that may be a mystery to both patients and healthcare providers alike. It's called Respiratory Dyskinesia, or RD as we may refer to it. Before we get into a discussion of RD, let's introduce our two guests who will be sharing their perspectives with us today. We're grateful to have Amy Youngquist with us, who has had respiratory dyskinesia for about a decade. She's from the Detroit, Michigan area and holds a Master of Public Administration degree from the University of Michigan. She worked for many years in nonprofit management, including serving as the CEO of a large organization dedicated to advocating for survivors of domestic violence and sexual assault. Thanks, Amy, for joining us today to share your experience.
Thank you so much for having me.
It's a pleasure. And we have with us distinguished psychiatrist Dr. Craig Chepke, who treats patients with this unique form of tardive dyskinesia from his practice, Excel Psychiatric Associates, in Huntersville, North Carolina. He also serves as an adjunct associate professor of psychiatry for the Atrium Health Psychiatry Residency Program and is the Chief Medical Officer of Psych Congress. Dr. Chepke has been recognized as a Distinguished Fellow of the American Psychiatric Association and is a recipient of the NAMI Exemplary Psychiatrist Award. Thank you so much, Dr. Chepke, for joining us to share your expertise.
It's my pleasure, Bill. I'm excited to be here.
Pleasure to have you. So, Dr. Chepke, can you first give us a brief explanation of respiratory dyskinesia and how it differs from traditional TD?
Well, so really the thing about tardive dyskinesia is that it is widely heterogeneous. It can look completely different in different people. It can affect almost any part of the body. And it's not just muscles we can see. The most common forms of TD are in the face, the orobuccolingual TD, but it can affect any muscle in the body, including muscles we can't see, such as the diaphragm, the intercostal muscles that are in between the ribs, and that's where TD can manifest sometimes with respiratory symptoms and be a respiratory dyskinesia. So imagine, for instance, that the diaphragm, of course, as it contracts, that's what forces our lungs to empty. As we breathe in, it has to relax in order to accommodate the air that goes in. But imagine as we're trying to take a breath in, that the person has an involuntary dyskinetic movement, the diaphragm cinches up, and then all of a sudden they're not able to take that breath in. They might feel like they're choking or gasping or struggling to breathe. Could manifest as difficulty breathing. Or if it happens when the lungs are inflated and it just is a kind of a rapid contraction, it can force the air out through the larynx, through the mouth, and can cause wheezing, gasping, even grunting, various noises. So there's a wide variety of presentations that just respiratory dyskinesia can take, and is most often accompanied by the symptoms of tardive dyskinesia in other parts of the body. Only rarely does it happen in isolation and without any other noticeable tardive dyskinesia in any other part of the person's body.
Wow, okay. Well, does that resonate with you, Amy? Is that kind of what you feel when with your RD?
Well, first, thank you, because you're one of a very tiny little group of people that actually believe that this exists and that it's a real thing. And all of those things are true for me. The noises and all of that, the throat and the breathing and the spasms, and I get a lot of pain in my throat. And I had TD for several years before the RD, and I didn't know what it was called. I just remember seeing commercials on TV with the medication that I was taking saying could cause involuntary movements. And so there was a very long road to get a diagnosis.
Amy, you mentioned diagnosis, and I would imagine it would be very difficult to get a diagnosis for this rarely understood form of tardive dyskinesia. How long did it take? Can you kind of estimate for us?
It took many, many months to get any real help at all. And then it took a couple of years just as a luck of the draw, I guess, that someone moved next door to me that was renting the home and was a neurologist and had told me about a program at Rush Hospital in Chicago where I did receive some help with Dr. Bailey. And she's left, and they don't take out-of-state patients anymore. But how did I get a diagnosis? Anybody and everybody that knew me just kept looking and looking and looking, like, what could this be? You can't just all of a sudden be out of breath. I'm someone who would ride a bike 10 miles. I would swim. I would walk. I was a very active person. And it was just the strangest thing. And it started when I was taken off Latuda cold turkey. And all of a sudden my TD turned into RD. And I still do have the TD, but it was many years I just lived with that and kind of tried to hide it because mostly it was in my feet. And then it started to become in my face. And I was actually taking my son to Disney, and the facial movements were there, but we worked through it. And then when I got home, I thought, oh, well, I'm just going to go off the Latuda and I'll go back on Zyprexa. I'll just have to be careful about my weight. Well, I came off of 180 milligrams of Latuda, cold turkey, and over the course of a few weeks, I just couldn't figure out what was happening. I just said, why am I out of breath? I dropped my son off for baseball practice. I always walk the whole time. I half a block, I'm out of breath. And it was just mysterious. I went through a lot of hard things with hospitals and doctors. I was told that I was, what is the word? I was out of shape. I was told by one emergency room, asked my zip code, and once they found out that it was a Detroit zip code, he had instructed the nurse to test me for cocaine, and I've never actually even seen cocaine except on TV. I had been to the emergency room about 4 or 5 times. My own doctor was begging the ER to admit me, and they would not. And I just kept being told that I had anxiety and that I needed to just calm down. And so, no, it was really the psychiatrist that I worked with, who is also a pharmacist and a gynecologist, and I do believe he is deceased. It's been many years since I spoke with him, but we tried so many different medications, and he literally saved my life. But it was a very hard road with some of these medications, and he believed what I was going through, and Rush Hospital did, but Rush Hospital didn't come into the picture probably for 3 years after all this started happening.
That's amazing that you had a neurologist move in next door. Is that correct? That's what you were saying? You
Yes.
had a neurologist move in?
Yes.
Wow.
Yeah.
That's amazing.
It was crazy because I was actually planning a trip to, I believe it was Texas, where there was a doctor that had published something called Tardive syndromes, and I realized later that I was speaking to the call center and that I was probably only going to get 15 minutes with the doctor. And I just happened to go outside to grab something out of my car, and I saw him, and I told him about my plan. And he said, well, why aren't you going to Chicago? And it was a significant improvement, but it wasn't an improvement enough for me to get back to a normal life. And I still don't have a normal life comparatively to what I had before.
So you still get easily out of breath? Is that kind of your main symptom that you deal with, you manage? Tell us about it. Is it an all the time kind of a thing, or is it episodic?
It's both. I mean, it's always there. And in the beginning, it was strange because I would be exerted by something that was so easy for me in the past. And sometimes later the spasms would start, like when I'd lie down for bed, and it just didn't make any sense to me. Why is this happening now? Most of the time it's triggered by exertion is the number one thing. So many activities in my life were no longer an option. And it's triggered by, if it's hot outside, cold outside. I used to be someone who would stay in Lake Michigan for 3-4 hours, just going with the flow, and and it really did. It changed my life dramatically.
So
yeah.
Oh, no, I'm sorry to interrupt. You tell your story really well. I mean, the way you explain it, and how it's affected your life. Dr. Chepke, she talked about coming off of Latuda like cold turkey, I think, if I remember correctly. And so that was, and then the RD started. Is this something that you've run into with other patients, kind of a rapid withdrawal bringing on RD?
Well, in general, people with tardive dyskinesia, if they are on a antipsychotic or other medication that blocks the dopamine receptors, like metoclopramide is one that is anti-nausea medication that commonly has a black box warning for the potential to cause TD. That TD is effectively, we believe, a hypersensitivity to dopamine. So as long as some of those dopamine receptors are blocked by the medication, then it prevents some of the dopamine from getting through and stimulating the excess unwanted movements. But then if the medication dose is lowered or completely taken away, all of a sudden every one of those hypersensitive dopamine receptors is open for business. And the dopamine's flooding in, and it just completely overstimulates the motor pathways in the brain and can exacerbate the tardive dyskinesia. It could exacerbate current symptoms just to be, maybe they were mild or moderate before, they become more severe, or symptoms that weren't there before could emerge now because of those unblocked dopamine receptors.
That makes perfect sense. Thank you. You explained that very well. Even I got it. So, moral of the story, if you're going to withdraw from a medicine, do it slowly, I imagine, and do it under the care of your doctor. Let your doctor know that, if you start experiencing some of these symptoms of TD or RD, let your doctor know before you start adjusting your own medication, obviously.
Yeah, the body almost never likes to have anything be abrupt. Whether starting something too much or taking something away immediately, the body likes nice slow increases, nice slow decreases of things. So you gave great advice there. Do it slowly and under the care of your healthcare under the watchful eye of your healthcare provider.
Now, you talked about dopamine, and obviously if our audience knows a bit about tardive dyskinesia, they've probably read a lot about dopamine and during their research online and et cetera. But, I've heard anecdotally discussion in some of our support groups. Like we actually, NOTD has an RD support group. And some of those folks have expressed that a medicine called gabapentin has actually been helpful. Has this been something that's been borne out in your experience? Because I think that works on the neurotransmitter GABA versus the VMAT2 inhibitors that we know so well with TD that works on dopamine. Can you comment at all on that?
Well, so a couple things there. So one is actually that it is an extremely common misconception, even amongst a lot of healthcare providers, that gabapentin works on GABA. One would think so. It's right there in the name, gabapentin. So the molecule gabapentin, structurally, it does look similar to the neurotransmitter GABA, but it actually does not have binding affinity to the GABA receptors. It works on. It is called a alpha-2 delta ligand, which is working on calcium channels. So very different mechanism, but it does have, for many people, a potentially positive benefit for anxiety. So this is intimately related respiratory dyskinesia and anxiety. Because as I mentioned, imagine as Amy talked about, you're trying to breathe and you feel like you can't. I mean, anyone, if you're swimming in a pool and you stay down underwater too long, you realize, oh my gosh, I'm going to drown. I can't breathe. The panic starts rising. Now imagine that sort of feeling happens to you when you're standing up on dry land or sitting in a chair doing nothing. It's going to evoke a primordial fear and anxiety response. And that, unfortunately, what I've seen has become self-perpetuating for patients, is that any hyperkinetic movement disorder like TD is exacerbated by physical or emotional stress. And so anxiety can worsen the dyskinesia. And then if you have a respiratory dyskinesia that directly negatively impacts your ability to breathe appropriately, then that's going to it further reinforce itself, and it can become a vicious spiral. And so where my theory would be that the gabapentin can help to reduce some of that anxiety that people are feeling, and that can help tardive dyskinesia symptoms to some degree. But there have been some small studies of gabapentin and some other gabapentinoids in tardive dyskinesia, but they haven't shown a great effect. The magnitude's not been great in overall TD, but possibly because of that anxiety component of RD being even more pronounced and more synergistic, it may potentially have a benefit possibly for some individuals.
Excellent, very well. Very well. I can tell you you lecture a lot on this because you're so smooth, and even I understand that perfectly. So, thank you for clearing up my own misconception about that. I was kind of wondering, what is this GABA relation to it? So it's GABA reduces anxiety. Obviously, it's one of the inhibitory neurotransmitters, I believe.
Exactly.
Yeah. So do you, when treating RD, do you treat it much like TD with VMAT2 inhibitors?
Yes, VMAT2 inhibitors, deutetrabenazine and valbenazine being the only two FDA-approved medications to treat tardive dyskinesia, and are both very effective medications, fortunately, for most people with TD. And they can help the overall symptoms of TD, and that includes respiratory dyskinesia. But everyone is so different in each person's individual symptoms. Some patients will have a fantastic improvement across most of their symptoms of TD in their body, but some of the body regions may not get as great of an impact. And we don't really know why, other than just saying that, everyone is wired differently, and the way that person's wired, the symptoms are more severe in one region of the body than it is in others. So hopefully it would help the RD equally as much as the rest of the TD, but that may not be the case for all individuals, unfortunately.
Amy, now that we're discussing treatments, what kind of medicines have you been treated with, if you have been, and have you received relief from that?
Well, when I was put on the Latuda, the very high dose, it was from the doctor who I gave all of his doctorates. He's pretty much a genius. He's very creative. Some may think he was, a little out of bounds sometimes, but I credit him with saving my life, because I had never been depressed or anxious in my life until I had my son. And 2 days after birth, I went into full postpartum depression and couldn't figure out what it was. And it took me almost a year to get help until I found him. And it was only because I told my rheumatologist what was happening, and her sister was suffering with the same thing. And she immediately called my gynecologist, and he had given the name of this doctor who really is a hero. He did instruct me to go off a cold turkey. I don't blame him. When I went off of a cold turkey, my feet stopped moving. My toes used to be bandages. They were all bloody, and I would try to hide my feet moving, and it went on for years. And then it was to the face. As far as medications, I could not even name the number of medications that I've taken. One day I put them all in a large tote bag and took them to the state police and dumped them in their container there. There was Trintellix, and there was Prozac, there was Valium, and all these different things. I can't even remember them all. I remember taking Remeron for sleep, and I became actively suicidal within the first day. But it was short-lived because I just went right off of it. So currently, my life is full of sedatives, and I'm very, very tired. And I lost the career that I wanted since I was 12 years old, that I worked really hard at, and I was there 19 years. And I expected to retire from there. And now what I can do in like a week, I used to be able to do on my lunch hour. I mean, I'm exaggerating, but you kind of get the point. There were many, many, many medications. I saw probably 6 or 7 different neurologists. I actually have a letter from Henry Ford saying that I've exhausted all possibilities with them. And that's a big, very prestigious hospital here in Michigan. And so currently I take Xanax 4 times a day, and I don't like it, but I do, and it makes you tired. But I take, the doctor had talked to another doctor who had recently retired, and he came up with the idea of putting me on, I think it's called the tricyclic antidepressant. The brand name is Anafranil, and I've been taking that, and that actually helped. It's expensive, but it does help. I was also on Valium, which we discontinued when I switched to a new psychiatrist. And the doctor in Chicago, I spoke with her for about 2 hours, and I just couldn't believe it. I just couldn't believe someone would actually spend that much time with me. It was very emotional. And she actually reintroduced a very tiny dose of Zyprexa to kind of stabilize me. And I've been taking that. And while my life is not normal in any way, shape, or form, I do my best. I can take care of myself. I get help around the house. I put my son through college with the help of his other parent. And unfortunately, after dozens and hundreds of hours of working on an application, received long-term disability and Social Security. And it was the most devastating thing for me, because I've had a job since I was 11. And for me not to have that organization, I grew up there. I was there all my 20s, all my 30s, half my 40s, and that was hard. But medications, you name it, I've been on it. And some of them with really, really unfavorable side effects. And so I'm kind of where I'm at, just maintaining at this point, but I am very exhausted.
So all that career, you had even gotten to the level of CEO, I believe.
Yep.
And at that nonprofit, when your tardive dyskinesia started first, right?
Mm-hmm. Yes.
And that was for a few years, and then the RD came on when you went off of the Latuda cold turkey, right?
Yes.
Okay, and that was a few years in. Okay.
Yes.
I'm sorry. Was that really the point where all of a sudden things became for you much more difficult to manage at work? Just typical things that you used to be able to handle no problem. Was the RD the thing that put you into kind of that area where, wow, I really can't do what I used to do? It wasn't the TD, but more of the RD development that did it, huh?
I mean, the TD was embarrassing because, I'd be sitting in a meeting and someone says, do you listen to music in your head? You're always tapping your feet. And then I'm stumbling to try to figure out what to tell her. Or, and then I worked with all social workers. And I'm not a social worker, but I worked with all social workers, and, they're very in tune with your feelings. And, well, we've been noticing that your face is moving. What's going on? And I'm like, oh, well, when I get back from this trip with my son, I'm going to go back on my old medicine and everything will be fine. And when I did, and the Latuda had been increased dramatically because I had kind of a dip in my depression. I was having a harder time. And with a lot of things. And basically, when I was on Latuda, I slept never more than 3 hours for 5 years. And I lost 70 pounds without trying, because I stopped eating, stopped sleeping. Not stop, but minimize. So it has just been such a long road. And I don't know that what would have happened if I would have just stayed on the Latuda. But when I did go off of it, one of the doctors who told me that I was out of shape and that I really wanted to have RD, but I don't have it because there's no such thing as having RD if it's not happening 24 hours a day. I wouldn't be able to sit and talk. So sitting here and talking, I'll be doing my breathing, just kind of going slow. I push myself a lot, but the movements in my face and my feet did stop when I went off that Latuda like that. And I had transitioned to Latuda because of weight. I had gained a lot of weight on Zyprexa, and I was doing very well on Zyprexa. I'm running an organization. I'm a single parent. I'm just be obligations with my family and everything, and I was doing quite well with my weight. We successfully and slowly and properly transitioned into Latuda, and then it was like, I'm not hungry and I can't sleep, but that was the trade-off, and that's just kind of how it happened. So, but the RD, it scares me. Like, I've been in situations, and like once I was at my son's baseball game and it was like 99 degrees, and I went into the car and I wrote a note like, if something happens to me, please blah blah blah. There's times I feel like it will kill me, and that's just being honest.
I'm so sorry to hear that. That sounds just awful. I can't imagine, feeling like you can't breathe properly. I mean, what a horrible thing to talk about, going into a panic or anxiety, just not being able to breathe. I can't, it's just so core to our functioning. I mean, how can we deal without breathing, right?
Yeah.
Dr. Chepke, this obviously, Amy has had quite a journey, as she explained. Can you kind of speak to what your own feelings about whether respiratory dyskinesia is at all known in the community, whether it's psychiatrists, neurologists, or other practitioners? Do you feel like it's pretty much unknown, or what are your feelings about it?
I would say it's relatively poorly known. Of the different specialties, neurology may know a little bit about it because it also can occur with Parkinson's disease. That people with Parkinson's disease, some can develop a levodopa-induced dyskinesia that in many ways can look like tardive dyskinesia, and it can happen. I actually also have Parkinson's disease patients who have had respiratory dyskinesia from levodopa-induced dyskinesia. So, but that falls mostly in the realm of the movement disorder neurologist. So a general neurologist may not have any experience or have heard of that. And then maybe perhaps pulmonologists might recognize it. When I began treating patients with respiratory dyskinesia a number of years ago, I really dove into the medical literature and searched and looked for it. And the studies in psychiatry journals really kind of started and ended in the 1980s for respiratory dyskinesia. There were a few studies that looked at it, but then after that, it kind of it petered out. But then I went and looked in other fields, looking in the pulmonary literature, that they had studies there. And what it showed was that the person would often have normal pulmonary function tests, that having someone breathe into a tube and to test how forcefully they can eject the air or how much air they can breathe into their lungs. A lot of those are often normal for people with respiratory dyskinesia. But if a video fluoroscope was passed into the trachea and you could watch it, then you could see the dyskinetic movements happening in the trachea and things of that nature. So there's maybe a few pockets where, but even amongst those fields, it's probably more constrained to a small percentage of the clinicians who are in that field. But unfortunately in psychiatry, where we see the most amount of tardive dyskinesia, I would say, I don't think very many psychiatrists or other psychiatric clinicians really have, just based off my experience talking to other colleagues around the country, it's very poorly known, unfortunately. But that doesn't mean it's vanishingly rare. Some of the studies that were done in the 80s that tried to estimate prevalence ranged, they're pretty wide range, but 7% to up to 16% of people with TD in small samples had respiratory dyskinesia. So that's 1 in 14 to 1 in 6, somewhere around there. So it can be potentially relatively common.
Could I say something, Bill? Would that be
Please,
okay?
Please, sure.
A couple of things is one thing I would say to anybody who's experiencing these symptoms, just talk to anybody and everybody. Like I'm talking to my neighbor, right? Hey, what are you up to? Literally just going to grab something out of the car. It's also when I was experiencing this very bizarre feelings that I was having after I had my son. I I even remember after I gave birth to him, I thought, who the heck would be depressed after they have a baby? This is so awesome, 2 days later, it hit me, and I'm looking at all these checklists and everything. And so I started telling my rheumatologist. I saw a dermatologist. I had a little rash on my foot or something, and I'm talking to him, and he says, Amy, I used to work in an inpatient psychiatric hospital. Everybody's on antipsychotics, and his words were something like, nobody's breathing in there, or nobody can breathe right, something like that. And it was like this young dermatologist telling me this, and it was so validating, but it was scary at the same time. And you mentioned the Parkinson's, and it's so, you just wish you had like an easy thing, like, oh, do you listen to music in your head, which was kind of an odd question, but I don't really get offended too easy. But sometimes I explain it to people, like, it's like having asthma and Parkinson's at the same time in your torso. And I have had the spasms so much that, like, I could lay flat and you can actually see, like, the jumping in my diaphragm. And that's when I knew, like, I'm in trouble here. So, but I don't want you to think that I'm ungrateful or blaming any specific person. It's not a very common thing. I was very lucky to be given a way to keep, my son and I going and stay in my little house. And I, my life changed a whole lot. And so I don't blame anybody. It's nobody's fault, and I don't want to sue anybody or blame anybody. I just want to get better. And I have some good days where I'm going all day, but I will pay for it, even though I tell myself I won't. But people say, well, build up your stamina. And I said, the problem with that is I wish that was true, because that was true my whole life. Build up my stamina. Go for a bike ride for 6 miles. Next week I'm going up to 10. I'm riding all over the place, swimming for hours and hours, getting up at 5 a.m. before work, going to the pool. But with the Tardive and the respiratory dyskinesia, it's like you don't build up your stamina. It chips away at your stamina, and that's the hard thing for me. It chips away, and I try really hard to, like, do the mind-body stuff and try to, like, demystify this and just kind of, all of that kind of stuff too, like in therapy, and that's helpful as well. So just to cope.
Yeah, speaking of coping, so your coping mechanisms, what are a few things you can recommend to somebody who feels like they're dealing with respiratory dyskinesia? I mean, you talked about don't exert yourself too much. Are there other things that you find, tips that you can offer that you have found helpful during this time?
Don't be afraid to say what you need. Don't be afraid to talk about it. It's a shameful thing for some people. My head used to rock back and forth, and I had someone tell me, you look like a mental patient, and things like that. And again, they didn't mean anything by it, but when you're walking with a group of friends, hey guys, I can't keep up at this pace, or I'm not going to be able to go on vacation in July in the hottest state in the country without staying in the room or being in air conditioning, or just to be honest, but don't limit yourself. Try to do things, but just, again, you kind of, it's like the spoon theory. Like, my friend has lupus, and she has this many spoons and she spends them all by 2:00, and then she's exhausted, and and she's doing great, and is working again and all of that, but she suffers greatly with the lupus, and a lot of these things are interconnected. So because I have a variety of health issues, and really starting around the age 15, I've never really felt completely normal, but I've pushed myself. I have 2 master's degrees, and my goal was to be the CEO of that nonprofit by the time I was 40. And I missed it by 7 days, but I did it. So
good for you. Well, this is a whole new kind of thing, but it sounds like you are still driven. Can you tell me a little bit more? You mentioned a few times about, I know you live in Michigan, so it's generally cool up there, except for maybe this time of year. So being in a cool environment helps?
It does help me. It's strange, but, like, we didn't grow up with air conditioning. Even when I was the CEO of my agency, the air kept going out in parts of my the office where I was at, and I said, you know what, we're not going to spend any more money on this, just to get a fan. And everyone's like, oh, we need air. I'm like, we're fine. I was always one to enjoy the hot weather, but it's just stifling. Like the humidity is stifling. It can be stifling. And but I don't really know what that's about. I had the whole pulmonary workup, if I didn't say that, by the head of pulmonology at Henry Ford. She is an angel. I think her name is Dr. Bazan. And she's like, your pulmonary function is pretty normal. You've never smoked, you don't have asthma, And so it's just one of those things that either you explain to people or you just don't explain to them, or it's just, you take it person at a time, because it can be exhausting. Like, hey, what do you mean you can't breathe? You need to lose weight, or so.
So, Dr. Chepke, wonder if you could comment. Well, first off, if you have tips or anything that has helped your patients, kind of cope with this difficult scenario, please let us know. And also, is it the fact that your body is not bringing in enough oxygen? Is that kind of that's so important to us being able to have energy to run properly? Is that, part and parcel of what we're looking at here?
Well, so first question was about some tips. And fortunately for my patients with respiratory dyskinesia as part of the tardive dyskinesia syndrome, the VMAT2 inhibitors have been very effective in controlling the respiratory dyskinesia symptoms for them. So that has, thank goodness it worked for them. So treatment with VMAT2 inhibitors would be my top tip. And Amy gave a bunch from a lived experience perspective. But it can be so different for people, just figuring out what works. And tardive dyskinesia is overall exhausting because you're working all your muscles to an excessive degree, all the unwanted movements. That's consuming some of the body's energy and burning calories and putting wear and tear on joints. And then with respiratory dyskinesia, sometimes and one thing I wanted to say is that Amy had said one of the physicians said you can't have respiratory dyskinesia if it's not 24/7. That's not at all true. It's often intermittent because as the muscles contract and expand, sometimes you might not have a dyskinetic movement that interferes with the natural breathing cycle. Your lungs your diaphragm might be contracting anyway, and if it contracts a little bit faster, not that big of a deal. But if it contracts when you're trying to expand, that's more of a big deal because it's reversing when you need to breathe in. So that kind of disruption of the natural cycle of breathing in, breathing out can be strenuous on someone's system.
Makes perfect sense. Thank you very much for kind of giving a better explanation. We have a support group, as I mentioned, for people with RD and NOTD, the National Organization for Tardive Dyskinesia. You can sign up for a session. It's free, and you can kind of share, meet other people who have respiratory dyskinesia, which is kind of a probably not something you're going to find very many places. Anyway, so. Please, if you have respiratory dyskinesia and you're struggling and you'd like to share your experience and kind of, just get some support from other people who have it, please sign up for our support group. You can sign up at tdhelp.org. That's tdhelp.org. And they meet every other week. You can also sign up for TD News at our website. At the same website by just entering your email address, and you'll get news on tardive dyskinesia every time we publish. Please also, I want to encourage you to go ahead and subscribe to this podcast. This is our first episode of TD The Whole Story, and we're going to be trying to delve into areas that are probably lesser known about tardive dyskinesia. And so hopefully that'll be really edifying for a lot of people. Are there any kind of final last comments or things that you would like to talk about before we sort of wrap it up?
I'd like to thank both of you, Dr. Chepke and Bill, This is a really great opportunity for me to get my story out. I'm not, the best public speaker. I used to do a lot of it at my job, but you kind of lose your confidence sometimes when you're dealing with something like this. And as I said, you never know. It could be a neighbor, it could be a dermatologist, it could be anybody. Just keep telling your story until somebody gives you some guidance and points you in the right direction. And again, I thank both of you very much.
Well, thank you, Amy, for sharing your story. I mean, it's you really did a wonderful job. I think you are a great public speaker. So you did great. And Dr. Chepke, I understand that I know that you lecture a lot on tardive dyskinesia. And we were talking before this started that you had talked a little bit about respiratory dyskinesia at a lecture last night. Can you just say a real quick note about that?
Yes, I was just giving a lecture on tardive dyskinesia to an audience, and I gave a little trivia question that I like to give is that when reviewing some of the different movements of TD, that the bulging cheeks can be a symptom of TD for some people. And I throw out a trick question to the audience of, does anyone know what muscles are responsible for the bulging of the cheeks? And all these physicians and nurse practitioners and everyone are always, is it the masseter? Is it the sternocleidomastoid? I can't believe he's testing me on anatomy right now. And finally, after everyone gives those answers, which are not correct, I say, no, there's no muscles that can in your face that can pull your cheeks out. The only way that can happen is through the diaphragm. The diaphragm contracts and then blows the air up into the mouth, and then it puffs the cheeks out. And then that led into a discussion of respiratory dyskinesia. And the audience was just completely fascinated. They had never heard of this. They had never conceived of this. And many of the people in the audience were familiar with tardive dyskinesia and did diagnose it, did treat it with VMAT2 inhibitors. And it just had never occurred to them that this was a possible consequence of tardive dyskinesia. And I was just grateful that I was able to give that education and knowledge to them, because now I know from talking to them that they are going to go out and look for respiratory dyskinesia in their patients going forward.
Well, that brings up a quick note. I just, when I was thinking about this before we started, I started thinking if someone presented with RD before they ever presented with TD, boy, that must be tough to diagnose, because all of a sudden you're having breathing problems, right? And you haven't, is that something that happens very much in your experience or what you've heard about? Because all of a sudden they'd be looking for pulmonologists and other people that may be not connecting the dots here.
Mm-hmm. So it's pretty uncommon. Probably less than 10% of people would have respiratory dyskinesia without having a current other symptoms of tardive dyskinesia that are more visible. But yeah, that's the pathway they would almost certainly take, is they would go probably to primary care, urgent care, emergency room, something like that. They would get referred to pulmonology. They'd have pulmonary tests. And it is important to have that medical workup, because they could have a pulmonary embolus, a blood clot to the lungs. They could be having a heart attack. There could be onset of asthma, COPD, things like that. Those medical things do need to be ruled out. But at that point, then I believe I remember Amy saying something along the lines of that basically we're told that it was psychosomatic, more or less. It's all in your head. That's what some patients that I have worked with were told, because all the tests are normal. Looking for when someone has those problems and they have the exposure to the dopamine blocking medications like antipsychotics, that should spark the idea of, well, maybe this is the tardive dyskinesia with respiratory consequences. Do a very good exam of the rest of the body to see, are there movements elsewhere, which if there were, then that would make it a much quicker pathway to get that diagnosis, because if they had the visible tardive dyskinesia in the face or in other parts of the body, then if that practitioner is aware of respiratory dyskinesia, it should then be a pretty straight line to draw from, okay, you have tardive dyskinesia, we see that, and these breathing symptoms seem like they could be caused by another different manifestation of the tardive dyskinesia. So that's the key, I think, is just knowing the history of being the dopamine blocking medication exposure, and having ruled out the serious potential medical consequences that could result in the, similar symptoms.
Thank you for going through that. I'm so glad I asked that before we signed off here.
Me too.
One other thing, if someone has respiratory dyskinesia, they may be trying to seek you out, and I just wanted to make a quick note of, I know you practice out of North Carolina, so if someone wanted to have a telehealth appointment or an in-person appointment with your office or with you to discuss their respiratory dyskinesia or their tardive dyskinesia, do they have to be in North Carolina?
Yes, the way medical licensure works is that that person would have to be physically located in the state that I'm licensed in, which is North Carolina.
Okay, just wanted to reinforce that so that people knew. There is a physician finder on our website at tdhelp.org if you're experiencing TD or RD. That can help you find movement disorder specialists in your area, which would be, I think, a very advisable thing to do. So please visit the website if you are experiencing some of these issues. Want to thank you both so much for sharing so well, your perspectives. It was really educational for me, and I'm sure everyone who tuned in. So just thank you so much for taking the time.
Oh, thank you so much for having me, Bill. It's been a pleasure.
Yeah, thank you very
Likewise.
much to both of you.
And thank you, Amy, for sharing your story.
Thank you.
All right, and remember to subscribe to our channel.
Yep.
This will be the first of many. Thank you very much.
Okay. Bye-bye.